Welcome back to CTV Morning Live, and we have paged Dr. Paul. And of course, you've been dealing with a lot at the hospital, seeing an emergency, people coming in with a long list of symptoms.
Sure.
And so we're going to kind of break down some of the symptoms, what can be treated, what can't be, and we'll start with kind of the everyday cold and the cough stuff.
Yeah. Everyday cold, literally no specific treatment, as you know, no antibiotics, and it's really what we call symptomatic treatment. And there's a whole slew of medications out there that people are taking or want to take, such as cough syrups and so on. The bottom line is really fluids and high humidity will help you. If you can't sleep or have discomfort in terms of cough, there are some syrups, and there are different types of syrups out there. There's the D, then the DM and the E. This is complicated, but one of them decongests you. Another one prevents your secretions from coming up. Another one prevents you from coughing. I don't mix them. I don't think it's a good idea to mix them, because if you've got a lot of secretions and you prevent them from coming up, then you don't want to cough. You want to cough, right?
Right.
And so I think that what we want to do is want to be logical about it. If you've got younger children, however, less than 6 years of age, those syrups, over-the-counter medications, are not recommended. As a matter of fact, they can be deadly, and you can seriously overdose. And people don't realize sometimes, just because it's over-the-counter, it's not dangerous.
Oh, I realize that, but don't they have kids' versions?
Yes, they do, but a child can get into it and get too much.
Okay. Right, so, but a kid's version of these medicines over the counter is fine. You just want to make sure that they're not taking the adult dose.
That's right.
Okay.
But for children less than 6 years of age, we don't recommend it. Although it says, I don't recommend it. No, it's not recommended. We've seen too many kids overdose. And the other thing too is, again, most parents worry about their child's cough. If your child's coughing a lot and can't sleep, then you can give a child a cough syrup, again, depending on the age, and you can speak with a doctor. So those are the things that you want to look. Don't give the ones that are mixed. That's the one I'm trying to avoid. People get all these concoctions that have a decongestant and so on. So that's one thing. Speak to your pharmacist and clarify it, number one. Number two, for fever, okay, what do you do about it? Well, you can't really treat a fever. A fever is there. It's a natural reaction of the body to get rid of the virus itself. And so what we do with a fever, if the child is uncomfortable, you can give the child Tylenol or acetaminophen or ibuprofen. Do not give aspirin. That's one thing that I want to tell people. Any child with a cold or any viral infection should never get aspirin. There are complications related to that. So Tylenol, those things are safe, given appropriately. Again, not for children less than 2 years of age, consult your doctor.
Can I ask you something? Because
Sure.
This was something that I was told. I sometimes alternate between a Tylenol and an Advil.
Well,
Have you heard?
Yes, I have. Yes, I have. I don't think there's reason to do that unless your child has febrile seizures, which is another issue.
Yes.
But I don't think that's, no. Every 4 to 6 hours, keep the child cool. Don't overdress the child. Those are the things that you should be doing. It's not how high the fever is; it's how the child looks. Which is important. People get scared. So, oh, my child has a fever of 103. The child's running around up and down the halls, and he looks fine otherwise. It's how the child looks. If the child is not feeding well, is lethargic, sleepy, and so on, that's when you should worry. So that, because people are worried about fevers. If the child is well otherwise, the fever is just a symptom.
Interesting. Okay, we don't have much time, but I know you wanted to get on to also.
Well, I want to get gastroenteritis, because vomiting and diarrhea, again, out there as well. The main point there is children will get dehydrated, and especially the elderly and children. What you want to do is give them a lot of fluids. You want to win the battle of losing the fluids. So you want to give them a lot of fluids. Do not give them just water. It has to be something with salt in it, and they have over-the-counter dehydration solutions. Even some soft drinks are better than just water.
What happens when it's the water that is coming right back up when you're in that situation?
Well, that's the thing, is that you have to give it again and give it again and start from scratch. 1 teaspoon, 2 teaspoons every couple of minutes. If obviously the child shows signs of dehydration, you should go to the emergency room. But most people stay home. You know, this is a self-limited problem, and you don't need any specific medication. Just keep them hydrated and keep them at home for a couple of days.
Great information. Always could pick your brain. drpaul.com if you are looking for more information. It's great that you actually have one of the first of its kind, this website that people have access to. And of course, always great to get it from the Medical Officer of Health of Eastern Ontario, the CEO there. Safe travels back to Cornwall this morning.